the health team in Armenia and co-leads the COVID-19 vaccine procurement and deployment team in Moldova. She has led and contributed to the design, implementation, and evaluation of reforms to improve access to high-quality healthcare through service delivery reorganization, strategic purchasing, revenue mobilization, and demand generation in Sri Lanka, Sierra Leone, India, Moldova, Tajikistan, the South Caucasus countries, and Romania. Her published research explores the determinants of access to and quality of care in low and middle income countries, motivated by theories and frameworks in the politics, microeconomics, health systems, and behavioral economics literature. Adana obtained her medical degree from the University of Nigeria and Master's of Science in Global Health from the University of Oxford, and a Doctor of Science in Health Systems from Harvard University. Dr. Adana, welcome.
Thank you very much, Emily.
So for our next speaker, Mrs. Amy Batson, who's Executive Director of Women Lift Health. Ms. Amy Batson is an Executive Director of Women Lift Health, an organization dedicated to expanding the power and influence of talented women leaders in global health and catalyzing systemic change to achieve gender equality in leadership. Throughout her 30-year career, Ms. Batson has provided strategic leadership with a focus on innovation and partnerships for a wide range of global health organizations. Most recently, Ms. Batson was Chief Strategy Officer and Vice President of Applied Analytics and Learning for PATH, where she led the organization's strategy, monitoring and evaluation, and market dynamics teams. In this role, Ms. Batson designed and stewarded PATH strategy, strengthening the organization's partnerships in global health communities, building a new line of business, and contributing to PATH advocacy and policy priorities, Prior to PATH, Ms. Batson served as a 3-year appointment in the Global Health Bureau of USAID as a Senior Deputy Assistant Administrator, leading the agency's engagement in the President's Global Health Initiative. She also represented the U.S. government on the board of the Gavi Alliance and led the U.S. government team in convening Child Survival Call to Action, which launched the global vision to end preventable deaths. Ms. Batson received her Master's of Public and Private Management from Yale University and a Bachelor of Arts in Economics from the University of Virginia. She is a non-resident fellow at the Center of Global Development, a frequent speaker, and author of numerous articles. Ms. Batson is a recipient of PATH's Vision Award and the World Bank's Presidential Award for Excellence. Ms. Batson, welcome.
Thank you very much.
And our next speaker, the Honorable Commissioner of Health for Kaduna State, Dr. Amina Mohammed Baloni is a medical practitioner who is a fellow of the West African College of Physicians. She holds a master's degree in public health and has had over 20 years of experience as a clinician and then as a public health professional. Her core competencies in communication, drive for results, and working with people developed during her years working in development helped her to achieve results working with government across various states to improve health and well-being of children and women through capacity building and transferring technical skills such as planning, analytics, formulating strategies, and monitoring for results. Dr. Amina is a team player who leads by building consensus among her team, passionate about developing people, and a good listener. A systems person, Dr. Amina believes that strong systems provide sustainable development and results. She has strong leadership skills refined through her training and honed at the prestigious INSEAD Business School. Her various certifications in health system strengthening, health financing, and the World Bank Institute have positioned her as a foremost professional with broad public health knowledge and experience to impact health systems and improve performance. Honorable Commissioner Dr. Amina, welcome.
Welcome, Anuli. Thank you for having me.
Thank you for joining us. And last but not least, Honorable Commissioner Dr. Coker. Honorable Commissioner of Health, from Ogun State, Dr. Coker. Dr. Tomi Coker is a renowned obstetrician and gynecologist studying medicine at the prestigious University of Ibadan, and trained at several prestigious teaching universities in London, including St. Mary's, Paddington, and Queen Charlotte's Hospital. In pursuit of her professional career, she underwent the fetal medicine training at King's College Hospital, London, under the globally renowned professor Kyprios Nicolaides. Dr. Coker was appointed as consultant obstetrician and gynecologist at West Hertfordshire Hospitals NHS Trust in 2003. She has a wide range of surgical skills, being the lead female gynecologist at West Hertfordshire NHS Trust, where she worked for 16 years and rose to the post of clinical director. She also has a keen interest in clinical governance and risk management. Dr. Coker is a fellow of the Royal College of Obstetrics and Gynecology and an alumnus of the Leadership Training in Healthcare Management at Harvard Business School. With a penchant for outdoors, Dr. Coker successfully hiked to the summit of Mount Kilimanjaro, Africa's highest mountain. Dr. Coker, welcome. Okay, so let us get started. Thank you so much for my esteemed panelists for joining us today. Without further ado, I'm going to hop right into the questions. So I know that I've given a very brief introduction of all of your accomplishments, and I don't think 1 minute is enough. But I just kindly ask that each of you just give us a 1 minute introduction of the work that you're currently doing so that our audience has a better idea of who our panelists are today. So I would like to start with Miss Amy Batson. Would you please give us a 1 minute introduction?
Thank you so much. Yes, so I'm Amy Batson. I'm the executive director of Women Lift Health, which is focusing on expanding the voice and the power of successful women leaders. And in particular, we're focusing on mid-career women all over the world, but who are critical actors in the health space, in global health and in the health of their country. So we're working with these women, working with their organizations, working with societal champions, to be giving sort of new tools, raising awareness, and overall working together to just be advancing how do we tap into the best leadership talent that humankind has to offer, not just the 50% that's male. And so that's the work that I am focused on, and I'm absolutely thrilled to be here to discuss this topic.
Amy, thank you so much for joining us today. We're so happy to have you. So I would like to give the floor next to Honorable Commissioner Dr. Amina. Would you please give us a brief introduction?
Thank you very much. The current work I'm doing involves the health sector in Kaduna State. I came into that job about a little over a year ago. And my focus is to have the health system become a strong and viable health system that delivers interventions to the citizens of Kaduna State. We're working on revitalizing the primary health care system, which was ongoing work before I came in, linking primary care, which is the best way that we involve the communities, as well as other groups, to ensure that health is put in front.
Honorable Commissioner, would you mind unmuting yourself? You're currently muted.
Oh, I'm so
Thank
sorry.
you. No, it's okay.
Okay, so I have to start all over again.
Oh, we heard most of what you said.
Okay, all right. So it's the work that is ongoing is how to make the health system stronger to deliver for the citizens. And in the light of the pandemic, how do we streamline the response to COVID-19 into normal health services to make sure that there's no further disruption of our healthcare system, to make sure that all our citizens are well cared for, both for COVID and other health challenges. Thank you.
Thank you so much for joining us. Next, I would like to give the floor to Dr. Adana. Please go ahead and introduce yourself.
Thank you, Anguli. So I am a senior health specialist at the World Bank Group. Before COVID hit us, a lot of my time was spent sitting across ministers of health and ministers of finance, thinking about how to finance healthcare for everyone, how to reorganize service delivery. But since January 2020, I spend most of my time thinking about the COVID-19 response. I'm currently working on supporting the Moldovan government to procure vaccines and deploy them. So, glad to be here and look forward to the rest of the discussion.
Thank you. And I believe there's a connection between you and Miss Amy Batson.
Yes, there is. So fortunate to be selected to the 2021 Leadership Journey cohort under Women Lift Health, and look forward to working with the rest of the team starting later today, actually.
And yeah, we're just thrilled to have Adana joining the Women Lift Health family. So it's a real pleasure to be here today with her.
Thank you so much. Well, we're really excited about the work that you guys will do. And last but not least, Honorable Commissioner Dr. Tomi Coker, are you on? I think she had a little bit of connectivity issues, but I believe she might be on.
Yes, I am. Thank you very much.
Wonderful. Please, if you just give us a brief introduction.
Okay, I'm currently the Commissioner of Health in Ogun State, 19, in Sub-Saharan Africa. So I've been very involved in the response and also the preparedness of the state and driving the coordination. But my passion really, as they said earlier on, is about governance. And when having left England about 13 months ago, arriving in Nigeria, kind of had a strategy which is built on 3 pillars, which is hub and spoke, standardization, and innovative funding, including technology, to drive and build a resilient health system. So that's where I am. And following the COVID, a better place, having built better from where we started at the beginning of the pandemic. My interest, of course, is also in maternal and child health, being an obstetrician and gynecologist. And so we're doing a lot of work around about changing our indices in the outcomes for mother and children. We're introducing interventions, both pharmacological and technology, to try and reduce the maternal mortality in the state by 25% by the year 2023. So that's me in a nutshell, and I look forward to an engaging conversation. Thank you.
Thank you so much for joining us. So I'm going to roll right into the next question. So this question is for Dr. Adana and Honorable Commissioner Dr. Amina. Dr. Adana, you can take the first question. Oh, you can take the question first, rather. So March is Women's History Month, as we all know, and on the 8th, we celebrated International Women's Day. This year's campaign slogan is Choose to Challenge. In your opinions, in what ways can we challenge gender biases and push for more inclusive participation in the global health space?
Thanks, Anguli. I think this is a great place to start. And I think, because there is a very important role for leaders in shaping the climate in our offices, in our meetings, that I will, sort of talk about things everyone can do, and then really narrow down to what I think leaders should do. So unfortunately, I'm sure we've all been in gendered moments, right? You're sitting in a meeting, a woman, utters an opinion, and everyone ignores it. And then 5 minutes later, I've experienced this, I've seen it happen. Some man says the exact same thing, changes one or two words, and it's like, wow, that's fantastic, we should do that. And so then what happens, right? And I think, when we are in those moments, everyone can do two things. So one, we can call bias out. And secondly, we can amplify the woman's voice. And, and on the second point, I have a story to tell. So just before the pandemic, I was in Korea with one of the ministers I support, and there were 3 delegations, the bank delegation and then the delegation for the other 2 countries. We're in this big meeting, and the 2 heads of the delegations, other delegations had spoken, and on the agenda, I was not listed as the head of the World Bank delegation, even though I was. And then the minister who I was working with at the end of his speech says, I would now like to turn the discussion to Dr. Adana, who is the leader of the World Bank delegation, to speak. And in that moment in which I couldn't have advocated for myself, it would have been difficult to. A man who was in power stepped up and called out the fact that my name was not listed and gave me the podium to speak for my team, right? And so, the ask here for everyone is to do that, is to not let that moment go by in terms of gender. But for leaders, who I think a lot of responsibility falls on, I would say 2 things. The first thing is that, it's almost like we are working and living in environments where the default is a situation that tends towards bias, right? So if you don't intentionally remove opportunities for people to look at names and make judgments, to look at to ask questions that are maybe skewed away from the woman, then it is less likely that this woman or this African woman will be selected to positions, right? And it's more likely that she'll be biased against. And so I think for leaders, there are opportunities to change the environment and make the default more likely to be fair, right? So think about things like anonymizing resumes. Think of things like making sure questions in interviews are structured in ways that are not biased towards one gender or the other, right? And then the second thing I would say is we need to set targets, we need to measure them, and we need to reward them, right? So today I saw a headline in Chipotle, 10% of the remuneration to CEOs will be tied to addressing gender bias, right? So making sure there's 50-50, leadership of significant projects, for example. What if we did that in our global health, projects? What if we said, leaders of those projects, a certain percentage of your rewards, or, performance evaluation has an indicator, on how many women have leadership of significant projects and things like that, right? So just to summarize, so everyone can call out bias, everyone can amplify a woman's voice, but leaders have a responsibility to change the things about the environment that make it easier to be biased against women, and to measure, to reward, and to set targets. So let me turn it over to Dr. Amina.
Thank you. That's excellent. Like they say in healthcare, right? If it wasn't measured, it wasn't done. So fantastic. Thank you. Dr. Amina, I'm handing the floor over to you.
Okay, thank you very much. I'd like to build on what Adana has said. We need to do 2 things. We need, from the side of the women, to increase our own agency, our own ability to be confident in what we are and what we can do, and to project strength. I think too often we come across women that want to use their femininity, so to speak, to get ahead. So it's doubly difficult when you have the ability and the capability, but people are looking at, oh, she must be, it's because she's a pretty face, or it's because she's, that actually prevents other women from achieving what they want to achieve if women use those as weapons. So we have to use our intellect more. We have to strengthen our own capabilities and project our own capabilities. I'd like to also agree with her that the environment has to be right. So we need to have environments that ensure equality of rights, looking at capabilities, access to opportunities, and that can be done by legislation sometimes, Affirmative action has worked in some places, but it hasn't. We have to have a foot at the door before you can actually say that affirmative action should not work. And then we need to work hard to eliminate gender bias within the working environment. So like she said, we need recognition. We need to remove unconscious bias from what we're trying to do. And then we need to work on the community and the greater environment, so to speak. Most of us live in patriarchal societies, and therefore we're conditioned and from an early age, oh, you're a woman, you can't do this. So we need to consciously work on very many levels. Here in Kaduna State, we're very lucky that we have a governor that really believes in the power of women and the work that women do. The deputy governor is a woman. About 6 out of the 14 commissioners are women, and they hold very sensitive and very, so to speak, sensitive in the parlance portfolios: health, public works and infrastructure, housing and social development, human services. That's all women. We have also women heading agencies, and that consciously the governor feels is a way of promoting women and making sure that people know that they are capable and they can do that. And there's a joke in the cabinet that says, "Oh, men are engendered species." And we think our governor is considered an honorary woman because he sticks up and stands up for us in every way. So you need the environment, and you need also women to really not limit themselves in any way. I've got 2 daughters, and I teach my daughters that you can do anything and be anything. And we have to keep the support on to the younger people and present them with role models of women achieving. And we have great role models in the whole world. We have the DSG, we have Amina Mohammed, we have Dr. Kunjo Iweala, we have other women that are excelling, and that, I mean, we have Kamala Harris. What more would you want? We have now women can see themselves in those roles and can aspire to be in those roles. And I think that can only be a great thing. Thank you.
Thank you so much. So I think something that you both said was really important. We talked a bit about amplifying voices and really providing opportunities, which is key. And I think that's a great segue into my next question. And I will pose this to Ms. Amy Batson and to Dr. Adana. So, and Ms. Amy, if you don't mind going first. So according to WHO, women make up 70% of the global healthcare workforce, but only 25% of leadership roles. In your opinion, how would structured mentorship and/or coaching specifically targeted at women begin to address this gap?
Thank you. So you're absolutely right. Women are the engine behind global health, behind national health, and yet, you know, we're so drastically underrepresented in the leadership roles, in the decision-making on policy, on research, on delivery. And that kind of gender imbalance it's deeply entrenched. You know, we've heard already about a number of these different problems that cause the imbalance. You know, it's this discrimination and bias and often outright sexual harassment. It's workplace policies that are kind of biased and make it very difficult for women to be able to advance or have the flexibility they need to be balancing kind of different needs in their lives. It's the societal norms around what it means to be a good mother or a good daughter or a good wife and also a professional, all of these things. But it's also around having the kind of skills, and we've heard role models on how to navigate your way to being a leader. And, you know, men often, you know, very often have these opportunities. They have mentors, right? They have peer networks. They get sort of coaching from, you know, on what it means to be a leader, on how to navigate your way when you face some of those difficult challenges that are about, you know, your path in the organization or about, you know, taking decisions as leaders. And we believe it's important for women to have these same opportunities to learn, and these same opportunities for themselves to see what can they do? How do they navigate? They are leaders, and they need these type of skills. So one of the core programs at Women Lift Health that we're so excited Adana is in is this leadership journey, which is a working woman's 12-month kind of journey that is focusing on women like Adana who are extraordinary leaders, and giving them some additional skills that they can then take on and employ in their own journey. And so that's, you know, some theory on best practices in leadership, but it's also on having a peer network. It's also giving them their own individual coaches to help them work through sort of kind of key questions they have personally. And it's giving them mentors in the health field that they can start to have discussions of, you know, what are we facing? How did you navigate this? What are some of the issues that one needs to look at when you're in looking at the broader health objectives, so that they are also kind of getting these extra skills for themselves, for them to be enhancing their own pathway. And it's critical to have that individualized, focused approach to be supporting individual women leaders, as well as we're changing societal and organizational efforts.
Thank you so much for that, Ms. Amy. I will turn it over to you, Adana.
Yeah, so, you know, building on what Amy just said, so I applied to the 2021, you know, Women Leadership Journey because mentorship, structured mentorship has been a very important part of my journey. You know, what has it done for me? It's helped me problem solve. You know, there are many times when I've been in difficulty. I remember, you know, finishing my master's in Oxford and being sort of confused. How do I get from here to advising national health reforms? And I traveled to Imperial College and sat down for 30 minutes with Professor Rifat Atun, in which we sort of mapped out what were the options, what's a different way to think about your career, you know, and some of the things we arrived at in that meeting, you know, they shaped decisions I made over the next 4 or 5 years on my career, right? And so, you know, I think, you know, what I would add to this discussion is that I have found value in both structured and what you would call unstructured mentorship. You know, some of the people who have the insights, whose, you know, perspectives I respect, just do not have the time to commit to meeting with me, you know, the sort of thing I will enjoy under the Women, you know, Leadership, Women Lift Health sort of cohort. I will enjoy, you know, structured meetings with clear objectives with a mentor, and that's wonderful. But for some of the people I want to meet, you know, they just cannot commit to meeting me every month or so. And so with those kinds of people, I still, you know, I'm fine with 30 minutes, 45 minutes of your time to help me brainstorm through a challenge, you know, and regardless of whether it is a structured or unstructured mentorship, I found that what matters are things like, you know, respect. I have to respect that person's views, their perspective. You have to add value in terms of, you know, what it is I'm trying to probe. And I think another thing that, you know, sometimes is lost in the mix is fit, right? So I'm a Black woman trying to navigate global health. And, you know, I found some of the mentors that have been able to see things, you know, understand my perspective and the struggles I'm going through are also people of color, you know, and so, you know, there are times when I've specifically looked out for, even in structured mentorship opportunities, I've requested for people of color who are more senior than me to be able to sit across from me and problem solve. But I've also, you know, sought opportunities and fit in different ways. So from people who are medical doctors who might not be, you know, people of color. And so, but I think fit is really, really important too. And I think the third thing is safety. You need to know in your interaction with a mentor that whatever you say there is not judged, that it will be received, you'll be listened to and heard, right? And then one last thing I want to add to the mix. So I recently transitioned to a more senior role in my institution, and I'm beginning to discover the importance of sponsorship. A person who is willing to expend social and political capital to move you forward in your career, right? And this person is obviously taking a risk, and so there is an onus on you as a woman to make sure you are clear on the value you add, to demonstrate that you are a high performer. But I've recently seen this in my career, and it's something I hope to cultivate moving forward, you know, to develop relationships with people, you know, who will step in and help move me forward, in addition to giving me advice when I need it as mentors. Thank you.
Thank you so much for that. So from what you both have said, we understand the importance of relationships. Relationships are key. No matter what position you're in, whether you're starting at a very junior level or whether you're very senior, building those strong relationships so that somebody can, offer some type of structured mentorship, as we've heard, or, be a sponsor for you is really important. So for all of the young women and for everyone that's really aspiring to do more in their career, let's think about nurturing the relationships that we have and how do we further build and expand on the ones that, we would like to soon develop. So let's move into our next question. And this is for Honorable Commissioner Dr. Tomi and Honorable Commissioner Dr. Amina. So women have often stood at the helm of leadership, particularly during times of crisis, especially in the recent pandemic. Unfortunately, their contributions often go unrecognized. From your perspective, what are some of the political and cultural barriers that prevent women from formally engaging in global health and rising to leadership positions? I'm sorry, I will give that question to Honorable Commissioner Dr. Tomi first, and then Honorable Commissioner Dr. Amina, you can answer afterwards.
Thank you very much for the question. I believe because in the leadership positions are male, and when a woman deemed as a negative attribute rather than a positive one. For instance, access culturally, women are meant to be seen in some cultures and not heard. And when a woman starts to be vocal, they tend to think the woman is forward. And young girls are usually told when they're young that, oh, stop being forward. And I think culturally, we need to start encouraging women to be bold. Naturally, most women are not courageous. As you know, there's a lot of research that shows that men would apply for jobs that they don't even have qualified for, just because they think they can do it. Whereas women are less, more reluctant to apply for jobs that they are overqualified for because they feel, oh, I don't want to fail. I must get it perfect. So we need to start with the mentoring that my previous speakers have talked about. We need to start mentoring women and making them step up to the plate and present their work. It's okay to showcase your work. And also politically, when you look at, I think my colleague in Kaduna is very, very privileged. When you look at other political constitutions, you'll find that women are very, very few in the leadership position. In global health as well, you find is the men that have the financial the financial capability to decide. Not necessarily they have it, they have the training to actually decide how the money is spent, because with the responsibilities of women, we don't put ourselves forward to get the skills we need to actually flourish in those positions. You're competing, competing demands for the family, your job. You always have to choose which one you have to put before the other. So juggling all those responsibilities will make women shy away from taking those leadership positions. So I think the political will should be there. There should be laws around appropriate representation of women at the leadership position. And culturally, parents and anyone that is influential should encourage women to actually take those leadership positions, especially our significant others. Thank you.
Thank you very much for that. So Honorable Commissioner Dr. Amina, I'll give the floor to you.
Yeah, so thank you very much. Thank you, Tomi. You set the scene very well. I think a lot of it is cultural. There is what is considered a woman's work and not a woman's foray. So you're considered negatively if you're in a place where mostly it's men. Why are you behaving like a man? And very often, for us to succeed, a lot of women assume those characteristics of males. and become aggressive. They're less empathetic, and that's sometimes what some people would say is the price of success. You have to be more like a man to succeed, and unfortunately, that also has a lot of consequences. So apart from culture, some of it is religious in interpretation, because even the one that is always pointed out as a Muslim woman, the religion does not place any limitations on a woman. It allows a woman to study, to be economically independent. It actually says that a woman owns her property, and it's can only give it to her husband if she wants. It's her property alone, but his property is considered hers. So there's a lot of misconstruction of religion as well. And then it's just the way it is. You have, like you said, 76% of women in health roles, but about 20, less than 30% of them are in leadership roles. So the decisions about work, about policy are taken by men, and they often don't have the perspective of women. So it's what they know that they think should happen. And so you need to have women in those spaces to give another perspective, to show that there is another way to things happening. And I dare say that where you have women in such roles, you see the difference. It's also in studies that organizations that don't have women in senior leadership roles don't flourish as well as those that actually women have women in those roles. So it's a lot of culture. It's also a lot of you've got the glass ceiling, which everybody knows about. Oh, women don't rise above a certain level. We can see that now. It's been shattered in every corner for our generation. So maybe it doesn't apply to our generation. And I think our children, our daughters will only be better for it, because they've seen women in those positions and they're doing excellently well, and they're leading in every way. So sometimes if you don't even see it, you don't think you can be it. But I think it's a glorious opportunity. And in global health, like we mentioned before, we need to have, the discussion. Very often, some of the barriers are actually biological. So you have to choose. If I want to have babies, why a man doesn't stop his career to have babies, but most women do. Maybe it's also the way we're wired. You bring forth a child and you want to be active in how they grow up, and it becomes less important. I think one of my favorite roles is mom, rather than actually physician. But it shouldn't be that is taken against a woman. In some banks, I think we've heard in Nigeria that in some banks they don't employ. Once a woman is employed as a single girl and she gets married, they either get rid of her or she's kept on the wayside, because they think, oh, she's going on maternity leave, she won't be back, she'll say her children are sick. And so we should enable women to have both. After all, men have both. They have families and they have careers. And I think if we are more mindful of the needs of women, with women in leadership positions, we will be able to make this work. Thank you.
Thank you so much. And I also think it's really important, both of your insights were very, very key. But I also think it's important to draw some parallels, right? So there are things that are happening, I guess the global north, that we can, that are very similar. So women, a lot of times are expected to shoulder burden of taking care of the home. So whether you have children, if you're cooking, if you're cleaning, and that also impacts on your career trajectory and some of the things that you have to do. So I think it's, as we spoke about culture here and religion, I think that there's some parallels that we can also draw that are happening in other parts of the world that are also kind of hindering women from reaching their full potential. So thank you both. I'm going to move to the next question. And this one is for Amy and Honorable Commissioner Dr. Tomi. So as accomplished women leaders, what practical advice can you give women who are seeking to advance in their careers? And I will give that one to Amy first, and then Honorable Commissioner Dr. Tomi, you can answer next.
So I would just pick out, there's a lot of different things, but I would pick out three. One that we've been discussing is, do seek out mentors, and as Adana said, sponsors, people who are actually willing to use some of their own kind of capital, political and social capital, to help you advance when you prove that you should be advancing. And it's important to think about, like, where is it that you need to be challenged? Where is it that you want to be challenging yourself and pushing yourself, and looking for these kind of mentors and sponsors who can help you reach those goals, and that are people that you can trust and rely on. But I think what's very important is recognize that mentors and sponsors aren't always who you're going to immediately assume. It's not always that person up on the podium that you're like, oh, we all want, Dr. Amina as our mentor, because she's extremely busy and she has people she is mentoring. But look in your own circle, right? You have opportunities like this course to listen to her, but then you have people that are in your immediate circle that sometimes aren't the ones you immediately think will be your mentors and sponsors, and yet, they do prove to be. But you only get as much good value out of what they have to say as you're willing to listen to. So it's really important that you have your ears open and you're listening and learning, and then taking on board that advice that is important for you. Second is taking risks, and I don't mean physical or safety risks, but taking those kind of risks of putting yourself out. And I think Dr. Kokorizal highlighted this, as did Dr. Mohammed, that when you make a decision that's going to be different than what everyone else has done, when you sort of think about defining a challenge differently, a problem differently, or a solution that's innovative, by definition, you're taking a risk because you're doing something that hasn't been, how the world has perceived the problem or the solution before. And that's a risk that you might fail, right? Or that someone might, make fun of you because you came up with a different approach. And I think taking those kind of risks is absolutely critical. And when I look back over my career, the places where I've had both the most fun and the most impact, but also advanced my own career progression, was when I was willing to take that risk, to recognize that somebody may not like what I was saying, to take like the less known, less cushy path, and do something that I wasn't 110% sure I had all the skills for. I was only 80% sure. And that's where you get the important opportunities. And then the third thing is, you have to look up. You have to go from being tactical and always looking down at, what I'm doing, how I'm making this progress, to thinking more strategically, thinking more about the big picture around you. And what's the vision? Where are you trying to go with what you're doing? What's the vision for your organization? Because that's what leadership is about, right? Leadership is having that bigger perspective and being able to then help yourself, help your peers, help your organization have more impact and navigate their way towards that bigger goal. And so look up and think about, the bigger picture of where you're going.
This is fantastic. Thank you. Thank you. Honorable Commissioner Dr. Tomi.
Well, thank you very much. My point is, the first thing is taking personal responsibility in painting your own picture and setting your own goals, set goals, which ultimately you're the only one that has the full picture of where you're going, and always make sure that you're not distracted by others. It's good to have mentors and to have coaches, but they don't have that perfect vision of where you desire to go. The second thing I would say is invest in yourself for where you're going. Don't wait till you need the skills to acquire the skills. Always see futuristically and acquire those skills. For instance, I never knew I was going to come into my post. I'm a clinician, a surgeon. And but about 6 years ago, I knew there was a course in Harvard about healthcare delivery system. I thought, actually, I'd like to know what they do about delivering healthcare. If you know, the NHS in England is a well-oiled machine, and you just get onto the mill and you follow the treadmill and you move to the next level. But I wanted to understand what it takes to have that sort of healthcare system. So I went to Harvard, and lo and behold, 6 years later, actually working in a clinical area, someone approached me that, oh, there's a post in Nigeria, would you like to take it? And I thought, oh, I've got the skills, I'd like to try my skills out. So you have to equip yourself and get the skills you need for where you're going. The third thing is your relationships. We've talked about relationships, sponsors, mentors. It is absolutely important. And never take for granted any relationship, because there are some relationships that we think are insignificant, but they end up being significant in your journey upwards. And particularly when you're getting to the peak of your career, because the people that you trained coming up are sometimes the ones that would get to the next peak of your career, because at some point you lose the momentum, but they've got the momentum, they overtake you and they pull you up because they remember that you trained them. So I'll tell, that's very important. Invest and continue to invest in your relationship. Keep in touch with people that you met on your way. We've said it many times, women don't like to make their accomplishment known. I've done it, it's okay. I'm not doing it to show off, show off. It's good for you because that's visibility. It gives you visibility. Not everybody would like it, but you know what? You never know who's looking, and they may actually need the skills that you are showing off. If you keep quiet about it, they'll never know that you have it. And always, always play to your strength. Don't focus on the things that you don't have. Focus on the things that you have, the skills that you have, and enhance them. With time, the ones that you don't have seems to, sort of blur away, and the ones that you have are amplified. So that would be my advice. Thank you very much.
Thank you very much. Excellent advice from both of our panelists. So just to briefly recap, seek out mentors, and some of those mentors, and I think this was such a good point, Amy, that you made, that some of those mentors may not be the ones that you see if you're like me, that's on LinkedIn and scours LinkedIn all the time, and that person that's always posting, but it can be your colleague that works right next to you, right? That has a wealth of knowledge that can really kind of just build those skills. So don't be so laser focused on one person, but explore all of the opportunities that are around you. So thank you, Ms. Amy, for that. And Honorable Commissioner, toot your own horn. I think that is really, really important. As you said, women like to play it modest, but men are big to say, this is what I've done, this is what I can do. And if they can't do it, they say, I'll learn how to do it, right? So we as women need to also be bold in coming into that, or in showcasing, the wealth of knowledge that we do have. I am going to sadly move on to the last question. This has been so good. And this question is for all of my panelists, and I will address the order in which you will say it. So we all know that enlisting allies is critical for closing the gender gap. In your opinions, from the lens of global health, how do we continue to encourage men to champion gender equality? So I will give this first to Ms. Amy Batson. Next, I will ask Dr. Adana. Next, I will ask Honorable Commissioner Amina. And then next, I will ask Honorable Commissioner Dr. Tomi.
Thank you. Men are a critical part of this solution. We need male allies. I mean, men are the ones that are in most of the positions of power right now. And they have something to gain from this as well. This isn't, just a zero sum. It is about inviting men and inviting male allies to be part of the discussion and to be part of the solution, and welcoming that, encouraging that, asking their views, and when they take an action, like, Adana talked about when this minister actually gave her the floor, recognized that she had been left out, and identified her power in this group using his own personal authority to do that, and gave her the floor. It didn't cost him anything, but it was so critically important for her as the woman leader of this bank delegation to have been given that acknowledgement by him. And that's the kind of thing that, we look for our male allies to be identifying how they can speak up when a woman makes that great point and nobody hears it until a man repeats it. Say, oh yeah, great point. When Amy said that 3 minutes ago, that was really an important contribution she made, right? These are, these type of things, inviting women to be on the panels, inviting women as speakers, inviting women as authors, recognizing the talents and the expertise they bring, is something that is just so powerful when men are helping to do it as well. The other thing I would say about male allies is also, and this is a point that high commissioners have made, is make a business case. There is actual data that shows having more diversity in your leadership, having sort of a more wealth of lived experiences, that not only of what men are living, but what women, and not only just women, but women of different races, women of different identities, bringing in that diversity actually improves your bottom line. And we have a McKinsey study that shows it increases profitability in companies. We see that, women are bringing in different solutions that are sometimes much more effective at how do we reach women? So how are you improving your health targets? How are you achieving these goals? So make the business case, bring the data, and show why this is better for the organization, as well as for the individuals involved.
Sorry, I'm on mute. Thank you so much for that.
Yeah, so excellent points, Amy. And so I think I want to speak like the last time to things everyone can do to, encourage men to be allies, and then things I think leaders should do. So I think I'll start with the point on leaders, which piggybacks on what, Amy said. We need to, I think, do better at making it clear to the males who are in positions of power why it is worth it to invest in promoting women, right? And then when we've made the case, there's a lot of useful information out there on how just having women in positions of authority begins to change how men think about who should lead and what leadership looks like, right? And so I think the second thing I'd like to tag on there is more women in leadership. That's what recruits more male allies. I read this book recently written by Julia Gillard and Ngozi Okonjo-Iweala, Women and Leadership. And they had this survey before and after Julia became prime minister, right? Of people, how do you think women should be leaders? And the proportions, were changing with whether a woman was in leadership or not, among men and women, right? So even though this is a chicken and egg sort of situation here, right? So more women in power makes more men feel like we're more allies. We need men to put us in power. But that I think there is a solution there. But for everyone, I think we look to childhood, right? So I think it was Dr. Amina that talked about how from the way we raise, we condition our boys to think about women in certain ways, to think about girls in certain ways. I think kudos to my mother. I cannot ever recall a conversation with her in which I said, I want to do X. And she said, oh, no, you can't, you're a girl. That never came up. And I think that was a big part of the reason why it's really difficult when I'm sitting across someone at work and they say, oh, you shouldn't do this because you're a woman. And many times the first reaction is confusion because, that's just not the way I've been conditioned to think. And so I think we raise male allies. We start from when they're boys to sort of help them to see that women can lead too. They might be lead differently, maybe, and that's fine. And there's something unique that they bring to the conversation. Thank you.
Thank you, Adana.
Thank you, everyone. Adama said it perfectly. We need to socialize our sons and our brothers to really get the role of women, to relish strong women. I come from a family of 7 girls and 1 boy. So there's nothing that we can't do. we have to do it. And I would say that my brother is a very good woman, because he understands us perfectly, and he encourages us and he moves us on. So the socialization is important. The work about gender roles and norms in our culture, the community, for people to understand that there are no limitations to what you can do. It's your gender doesn't come into play. And also to like we said, encourage those that speak positively for women. As women, we also be positive and provide positive pictures, shall I say, the word left me, but project positivity, so that when people are standing up for you and talking for you, it's because you deserve it, and you've played that role, and you've projected that role, and you've really shown that a woman is capable, and you're capable. And also not to be careful about ramming it down men's throats. This is something that's been on for centuries. It's difficult for them to understand. Anyway, nobody yields power. You have to actively work at it. So if we want to have male allies, we need to also show that we're capable, and then also to socialize better and talk to the community better, support, like you said, the men that are advocates for women, by showing them that they didn't make a mistake. And for us, the women, we need to also remember that this is generations of conditioning. And for some, it may be a little bit difficult, and we drag them kicking and screaming like we drag our children to things that they should go to, even when they don't. Thank you.
Thank you. Last but not least, okay.
Oh, thank you very much. I'm just going to be very brief. My point would be that with men that show gender bias, I think we ought to, in a subtle way, educate them about the advantages that bringing the woman into the mix actually brings, and the disadvantages of not having a woman, the merits and demerits of the position. And I think with character and integrity, consistent character and integrity as a woman in a position, you can show that you're not using your gender as a tool. I think women, we have responsibility as well as women to ensure that we're not using our gender as a tool. The third thing I would say is celebrating the men that actually that encourage women, and not undermine them, because sometimes when we women find ourselves in position with men supporting us, we can sometimes undermine them and not strengthen their position as a support system, particularly around homes and around relationships and in the workplace. Not being a bossy, they say boss woman, not being a boss woman is very important. And so that would be my contribution to that. Thank you very much.
Thank you very much. So before we wrap up, and I thank all of our guests, I know we've overrun. I just have a small request. I know we're all here supporting, Choose to Challenge, and we're supporting the women that are around us, ourselves. And I just ask if everyone can switch on their cameras, and we can just, in a sign of solidarity, just go ahead and hold up our hands, and we'll take a screenshot and post it. And I just ask everyone, please, this conversation shouldn't stop here. We should really just choose to challenge all of the biases, all of the ways that are holding women back, and look within ourselves, within our organizations, how can we support women to advance? So I'm going to ask everyone on the count of 3. I think we have our marketing team here that's going to be taking the the shot. So maybe you guys can let me know when you're ready. So I'm going to ask everyone, I'm going to switch this over to gallery view. Everyone that is on the call, if you don't mind just holding up your hand, we're choosing to challenge, we want something better. So I'm just asking you all now, marketing team, please let me know when you're ready to take the picture. Okay. Thank you guys. So we are going to take a few shots. Just give us 1 minute. Smile if you want to. But thank you so much for joining us. Have we gotten it? I think that's either Liz or Henry. Just let me know so everyone can, if we've gotten the shot already. Yes, no, maybe so. Okay, guys, just 1 more minute. We'll take another shot. Thank you so much. I'd like to thank all of my guests. I know we had a few questions, but we've sadly overrun. But like I said, the conversation should not stop here. Please find us on our social media handles. Check out our website. This recording will be out shortly if you missed it or you had to join late. Thank you so much to our distinguished panelists. I learned so much. I'm sure our listeners learned so much. Thank you so much for your time. We really appreciate it. Everyone, go back, choose to challenge all of the biases that are holding women back. Thank you so much. International Women's Month is every month. Thank you guys. Well done.